Medurstand-Understanding Medicine.
Professor Aziz Rehman from Medurstand, and I'm going to demonstrate how to test the second cranial nerve, which is optic nerve. Optic nerves, like all other nerves, there are two, one on the right, the other one on the left side, and it has got one very, very important function, that is our vision. It has some other functions also, but main function is the vision. So the function related to vision, I think first of all, visual acuity. If patient can see things clearly, of course it is done in the best way in ophthalmology department, but very, very simple way of checking visual acuity, both distant vision and close vision, I'm going to demonstrate. Then color vision. You know, we are able to differentiate between different colors, and that I'm going to just tell you how we do that. Then field of vision, and then ophthalmoscopy, which is extremely important, very, very, I think, great skill which every internist should know. Of course, for detailed examination, we all refer the cases to our ophthalmologist colleague, but every internist should need to know the basics of a thermoscope and how to use it. Then pupil reflex, that is mostly covered in when we test third cranial nerve, but very, very briefly I'm going to show you in this also. So let's test visual acuity. आप इधर को घूमें. First the distant vision. I think I can check with both vision. वो दीवार पे क्या लगा हुआ है? क्लॉक लगा हुआ है. उस पर आपको टाइम नज़र आ रहा है? जी. टाइम बता सकते हैं? जी, 11:40 ओके. अगर मैं आपकी एक आंख बंद करूं, अब सही नज़र आ रहा है? जी सर. बिल्कुल ठीक? जी सर. अगर मैं ये बंद करूं तो भी सही नज़र आ रहा है? जी सर. ओके, बिल्कुल. और ये आप पढ़ सकते हैं? पढ़े ज़रा. ड्यूरिंग इंटरव्यू. सो बिल्कुल. He can clearly read it. Again, I think ideally both eyes should be tested separately. आप पढ़ सकते हैं बिल्कुल? जी सर. आप पढ़ सकते हैं? जी सर. Okay. So he can read it because he is an educated person. But if somebody is not educated and you want to have some idea about the vision, then you can just do the finger methods. ये देखें मेरी तरफ. कितनी उंगली हैं? 2. अब कितनी है? 1. अब कितनी है? 2. अब कितनी है? 3. So without any confusion, without any problem, he can clearly tell you the number of fingers. So this is very simple way of testing visual acuity. Of course, before we test the visual acuity, we need to ask if the patient is elderly, if he's got a cataract or something. Then color vision, I think we have those charts. I'm not going to demonstrate it here because I don't have that chart. So I think that can be used. Then field of vision. I think this is important. Let me demonstrate how to do the field of vision. मेरी तरफ देखें ज़रा. So field of vision, basically in philosophy, you assume that your eye structure and your field of vision is exactly the same as patient's. So with that assumption, you first test both eyes together and then one eye individually. So I think both patient and physician should be at same height. So I think we are the same height, sitting facing each other. मेरी आपने आंखों में देखना, ठीक है? And throughout the test, you need to remind the patient that he has to keep looking into my eyes. He is not required to follow my finger. ये मेरी आपने आंखों में देखना, दोनों आंखों में देखते जाइए. मैं जब कहूँगा इधर देखें, इधर मैं इसको आपको उंगली का पूछूंगा, लेकिन आपने आंखें उधर घुमानी नहीं है, ठीक है? सिर्फ मेरी आंखों में देखते जाना. ओके. सो ये उंगली नजर आ रही है आपको? एक आ रही नजर. अब मैं अंदर लाऊंगा, देखते जाए. नजर आ रही? जी सर. बिल्कुल नजर आ रही. मेरी आंखों में देखते जाए. नजर आ रही? जी सर. नजर आ रही? So I have to move this finger straight line in the mid of both subjects and throughout. So he can see it like this. And now in this, मेरी आंखों में देखते जाए. नजर आ रही उंगली? नहीं आ रही ना अभी? अभी भी नहीं आई? Abhi. So both of us should start seeing the object at the same time. Exactly when I saw my finger, he also saw it. So we have the same field of vision. Just मेरी आंखों में देखते जाइए, देखते जाइए, देखते जाइए. नजर आ रही उंगली?
जी सर.
अभी भी आ रही?
नहीं अभी.
अब नहीं आ रही. ठीक है. So then I think in this angle, maybe we can start from here. नजर आ रही?
जी सर.
मेरी आंखों में देखते जाएं, देखते जाएं, देखते जाएं.
आ रही है सर.
आ रही. And finally in this,
अभी आ रही है सर.
so I think I need not do it complete test, but same has to be repeated with one eye. I'm going to close his right eye using my left thumb like this very gently and close my left eye. So his left eye corresponds to my right eye because we are facing each other. So like this, I have covered his right eye and I'm going to close my left eye and do the test again, against all four quadrants. Then I will cover his left eye and close my right eye and then compare the same. So this is how we test field of vision. So since my field of vision corresponded with his field of vision and I know mine is normal, so I think on this test I can say that his field of vision is also okay. There are a number of abnormalities which can happen with this field of vision. It could be contracted, there could be scotomas, and I think you can read the differential diagnosis. The purpose of this video was just to demonstrate how to test field of vision. One additional thing which we test in second cranial nerve evaluation is the accommodation reflex. What is accommodation? When we see at a distance, our position of our eyeball is slightly different. When we concentrate on something very close, our eyeballs move medially and pupils also constrict so that we can focus on that object also very well. So this is called accommodation, and this is done through the second cranial nerves using some brain circuits. So I think very simple thing is that if I ask the patient, I am looking in patient's eye and concentrating and seeing the pupil size, and I will ask him to look at the distance first. Oh, घड़ी पे देखें. So I am looking in his eyes. Then I will ask him to see at something at closer distance. इसमें देखें आप, इस उंगली देखें, राइट. फिर वहाँ देखें, फिर इस उंगली भी देखें, राइट. Okay. So this was it. I think his accommodation reflex is intact because when he looks at my finger, his both eyes move slightly inward and pupils are constrict both simultaneously and equally. So accommodation reflex is also okay.